Healthcareonomics, changing healthcare by changing the way you think about healthcare. Hi, everybody. Welcome to Healthcareonomics. I'm your host, Dr. Kevin Wacasey. And again with me this week is the one and only Tom DiLiegro from Benefit Advisors of Charleston. Tom, how are you doing this week?
Dr. Wacasey, great. How are you?
I'm doing great. The weather here is a little bit chilly for the spring in Texas, but I'm looking forward to some warmer weather soon. I know you are too.
Yeah. When I signed up to move to South Carolina, I didn't sign up for 30 and rainy, so for at least in March. So it's kind of weird.
Yeah, it's kind of crazy.
Yeah.
Well, so this week we wanted to discuss a few things that have popped up that we've come across. This is our Healthcareonomics for Employers series, and we really want to talk about how employers are getting ripped off by health insurance companies, by health insurance brokers, which Tom is a health insurance broker. However, he's not your usual run-of-the-mill health insurance broker. He is definitely taking a stance on trying to think outside the box and get out of the rat race and try and really help employers save money by making wise decisions, smarter choices when it comes to their healthcare coverage. So, Tom, you want to tell us a little bit about your business?
Sure. And thank you. I appreciate that introduction. It takes not a run-of-your-mill physician to recognize, I suppose, a not for run-of-your-mill physician. But I will say, as I meet, I think the movement is growing as a lot more, especially primary care physicians, are adopting some of these things that we've been talking about. I met with one this morning who actually recognizes the fact that healthcare, as you say, is not expensive; it's the charges. So. So what I do is I help employers put in plans that are more affordable and attractive to their employees. And when I say more affordable and attractive, almost by definition, that means they have to be non-insurance based. I'm not saying insurance isn't a part of the equation, but it is certainly not the end-all be-all to pay for everything, because not everything, frankly, needs to be insured.
That's right.
So that's our philosophy and the message we try to carry.
You know, I've written a couple of books, and the first book is called The Guide to Buying Health Insurance and Healthcare. And you and I have talked about this off screen, but I wanted to go over it with the audience. This little segment in the book where I'm going to do my Texas accent now, where a typical broker would say, now, if you want to buy the bronze plan don't cover hearing aids at all. You just ain't going to get them. Now, the silver plan will get you hearing aids in the let's see, is it the left ear or the right ear? I think it's the right ear, but on only in even numbered years. So this year you're out. But now the gold plan, if you want to buy the gold plan, I mean, hell, you can put hearing aids in your dog if that one, if you want to buy that one. So that is how I think a majority or a lot of these health insurance and health benefits brokers pitch their products. I could be mistaken about that, but I would imagine that would be the way they do it because they're commission-based. I've been told that we don't make money on commission. We don't make money by upselling plans. Well, then why offer the upsold plans? Why offer the bronze, silver, gold packages? So these benefits brokers are making a ton of money, and it's my contention, of course, you know, I'm just guessing here, but it's my contention that a lot of them make a lot of their money by just being misleading, by continuing the confusion, by not painting the whole picture for the employer. And what you just said holds true, holds very true. It's one of my basic points is that you don't need health insurance to pay for everything. And if you're paying for a health insurance policy that pays for everything, you're paying way, way too much.
Right. And I encourage everybody, I just read or listened to this book on a recent trip, and I would encourage everybody to read Good to Great by Jim Collins. Mm-hmm. And so he analyzed over a period of 15 years how good companies transition to being great companies, and he keeps referring to this thing called the flywheel. And the flywheel is a self-perpetuating momentum that companies leverage to propel themselves from being good to great. So I was thinking as I was listening to this book, well, what is the flywheel for my industry? And for so long, in order for insurance brokers to prove their worth, they have to show employers and employees what they're representing in the form of an insurance product, how great and beneficial it is for their people. Therefore, they're trying to sell things that pay for everything because, oh my gosh, I want to be the hero. I'm giving you this product that pays for every darn thing under the sun. And what does that do? It keeps that flywheel turning around. So you come back to that same person. Oh, that was great. It might be expensive, but darn it, that insurance product paid for everything.
Yeah,
and
which
nobody
is
stops and asks the questions, should it?
which is
because
what
we can, right?
yeah, because which is what employees want. I think employees demand that, employees expect that and require that. And in fact, I think in the Middle Ages, that wheel you're talking about would have been called the Wheel of Death. But bottom line is, it's something you can't get off of. It's very hard to get off of once you're on it.
Right.
But really, educating employers or changing all this starts with educating employers and then ultimately educating employees. And Tom and I are working together, and we're going to plan to work together in the future to try and help employers do that on a more broad basis so that we can get people changing their minds and get people to see how big of a ripoff health insurance really is. So last time we talked, a couple of episodes ago, Tom, we were discussing this medication called Armour Thyroid. And I have to say that I didn't finish an explanation in that podcast. I had mentioned why it was called Armour Thyroid, but I never explained why. And as I explained in the podcast, this drug, if you will, is nothing more than dried and ground up thyroid glands from pigs and cattle. Why it's called Armour Thyroid is because one of the big meat packing plants 100 years ago that was cranking this stuff out was Armour meat packing plant. So it's literally called Armour Thyroid because it's more of a I don't know, a beef or a meat byproduct than a medication.
First of all, gross. That is gross. Okay. Second,
it's all natural.
I've learned the background behind everything, so I think only you would understand where that came from. That's pretty cool.
It's so bad they can't even put it in your sausage or your hot dog. But they grind it up, they sell it to you for an exorbitant price, especially when covered through health insurance. So if you're interested in hearing that little exchange, go back and listen to Healthcareonomics for Employers episode 2. We discussed that at length. But you have another thyroid story that I wanted to go over today. So tell us about that. Let's hear about what's going on.
So I have another example, and it seems like the biggest in my travels, in my discussions, the two big things that I come across are diabetics and people with thyroid issues. It seems to be pretty common, non-catastrophic, but just those annoying, what people think are relatively expensive month-to-month issues that need to be maintained.
Right. So
came across an individual who was actually on her parents' plan, traditional insurance plan, and she went to the physician, and they recommended that every 8 months she go and have her thyroid evaluated via some sort of scan. Now, every 8 months.
Okay.
And I was thinking, this poor girl, relatively young, imagine hearing at 23 years old that you have to have your thyroid evaluated every 8 months for the rest of your life.
With some kind of a scan, but you don't know what kind of a scan this was.
I do not. So,
but they recommended every 8 months for how long, though? That was what got me in this story. Forever, for the rest of her life.
Yeah. That was what she was worried about, right? And I'm looking at this poor girl going, wow, you poor person. And where I failed, where I value having you as part of my team, is having that perspective of, no, wait a second, do we really have to do this? And again, not to belabor the point, but the concept of the flywheel comes back, right?
Right.
And it exists on the physician side. Well, they know if it's covered, so to speak, at a relatively affordable price, well, why the hell not?
Yeah.
Keep going. It's going to be covered. The real price might be whatever, $8,000 or whatever it might be, but your copay is only $250. So go every 8 months.
Do you have any idea how much she is spending every 8 months out of her pocket?
No, this will be the first time that she would be looking at it as an individual shopping on her own, standing on her own 2 feet on her own.
Or has the employer been paying for this every 8 month thing?
It was she was dependent on her parents' plan, so.
Gotcha.
The parent's employer was incurring that annual increase for however much it was.
Well, when you told me this story first, the point I wanted to make about it from a medical standpoint, from a healthcare standpoint, never mind the health insurance piece, from a healthcare standpoint is I am not aware. Now, I'm not a thyroid expert, okay? I'm not a thyroid guy. I'm not an endocrinologist. So maybe there is a condition that requires a scan of a thyroid gland every 8 months. I don't know what that would be, especially something that's to be scanned every 8 months ad nauseum for the rest of her life. I have no idea what that would be. And in fact, I would say that if you've got something that is that bad, probably an okay idea, and this is not medical advice, but probably an okay idea to just have your thyroid gland ripped out and go on medication if you're that worried about your thyroid gland. Yeah, surgically.
Right.
Exactly. And that's not surgical advice either. But I'm just saying that I'm unaware of that. Now, it seems to me that there are some unscrupulous, probably lots of unscrupulous healthcare providers, physicians, doctors, hospitals, whatever, who would recommend, as long as your insurance is covering the thing, yeah, let's get it scanned every 8 months. Yeah, come on in, cha-ching, every 8 months. I don't think that's good medicine. I don't think that's a good medical practice. Any endocrinologists out there or other experts want to correct me on that or give us some feedback, please do so in the comments section for the video. But otherwise, I don't think that's good medicine. And I certainly don't think it's a good idea for her to be having a scan done every 8 months, especially if it's got radioactive dye being shot through her body. That being said, let's say that she does need a scan for a few times every 6 to 8 months. But let's just presume that this is an ultrasound scan. Now, here's why I don't think this ought to be covered by health insurance. Is because an ultrasound of the thyroid gland, I mean, I can get my patients those in my direct patient care practice. I can get those for $150 cash. Or credit card, debit card, HSA card, check, whatever. But if a patient's willing to pay out of pocket directly for that, it's $150. That's pretty easy to swallow, no pun intended on the thyroid gland. But that's a lot easier to swallow than the thousands of dollars that they're probably getting billed through the health insurance claim that she's going to file every time she does this study.
Right. And that's the missing piece, right? So as we sit here and we talk about the conditions, we sort of do it somewhat in a vacuum. It's hard when you're sitting and listen, there are good health agents and health insurance advisors out there who I'm sure would take the time and do the due diligence on the market price of a particular scan of the thyroid in a given geographic area.
Right.
But it's not common, right? So when you're put in that position and somebody's worried about that, again, the common response from somebody who's helping an employer and employee population is to jump in and fix it and say, oh, well, I have a solution for that concern of the cost of yours. Boom, here's another high cost insurance product that covers it. Okay. Because it's the easy button.
Right.
And the missing piece is that transparency where those prices are, commonly known, and that takes a lot of the pressure off somebody in that situation, and also for the person who might be advising that employer on how to devise a plan that fits the needs of his employees.
I would submit, folks, if you're an employer and you have a benefits broker who is not servicing your needs in this regard, then you definitely need to consider what you're paying for, because this is something that needs to absolutely be thrust upon your employees and your own selves, employers, is that most of your health care throughout the given year, if you just decide and choose to pay for it directly, it's going to be a lot less, and you won't file a claim on your health insurance plan, which does what, Tom? What does that do again when you file a claim on your health insurance plan?
I think the prices go down, Doc. No, I'm sorry.
Yes,
I was mistaken.
The premiums go up. It's sort of like car insurance. Duh.
That's right.
Yeah, you file a claim on your car insurance for a fender bender, your rates are going to go up. Well, the same thing happens with health insurance, guys. So employers need to be understanding this. So that brings me to a second story I wanted to get into this week. It's an amazing one. It really is. About how these benefits brokers are definitely helping their employers, and their employees, but at what cost? So there is a local benefits firm here in the Dallas-Fort Worth area, and I've actually met the owner. In fact, a few years ago, we talked about doing business together, because what I would really like to be able to do is advise employers and consult with businesses on how to save money on healthcare and health insurance. So we had a really great meeting. Her and I talked for a few hours. She told me, gosh, we could use you. I mean, there's all kinds of stuff you could do for us. And then I let it slip that, I don't really believe in the employer-sponsored health insurance system. I mean, I might as well. She, in terms of dating, 21st century dating, she ghosted me. Okay,
Swipe left, I think, right?
Swipe left. Yeah, I didn't hear back from her and couldn't get her to contact me, couldn't get her to call me back or take my messages, man. But the bottom line was that I think that's what did it was when I mentioned, hey, an employer-sponsored health insurance system is bad. And guess what? It is bad. I still think it's bad. I think it's a horrible way to sell health insurance. I don't think that employers should be in this mix whatsoever. I'll fully admit that the last place I want to get my health care from is looking at my employer across the table from me. That's a personal decision. But we do have, unfortunately, this employer-based health insurance and healthcare coverage system, and it ain't going anywhere anytime soon. It's sort of like the tax code. I can gripe about the tax code. The tax code sucks. We need to redo the tax code, make it a lot simpler, make it a lot more fair. But you know what? I can scream and gripe all I want to. Yeah, that's not going to change much anytime soon, is it?
Watch your back. Those nonprofits are going to be after you.
Well, so exactly. So actually, I did run a business for a few years that didn't run a profit. Can I qualify as a nonprofit? Anyway, I don't think so because I'm a rich doctor. But anyway, the bottom line, I guess what I'm getting at is that just because I say that employer-sponsored health insurance is not the best way to do it, the fact of the matter is there's plenty of employers who are who are still doing this, who are going to do this because they want to stay competitive. They want to stay in the marketplace. They understand that they have to do this. This is part of the cost of doing business if they want to retain their workforce. Okay, so to get to my story, though, I happened to look at this company's web page the other day, and I found something very interesting. And I have to say, I thought I knew everything. Okay, I thought I had it all down. Nope, I do not. And this really didn't outrage me, but it shocked the heck out of me that this is going on. So apparently, her company has some kind of a discount card called the Purple Card. I don't know what this is. I haven't researched it fully. Not sure I'm going to. But she had a cute little anecdote on her website about how one client of hers, employee, went and got lab work done and spent $1,800 on the lab work. In other words, they were billed $1,800 for this lab work. Now, as you know, it's not the costs of healthcare that are outrageous, it's the charges. So the $1,800, I'm sure, was overinflated. Well, so the employee thought that this was a mistake or perhaps treachery. So the employee contacted this benefits company, the benefits broker for their employer, and the Purple Card team sprang into action. They donned their superhero cape and got to the bottom of what was going on. And what they found was that indeed there had been some significant overcharges for this $1,800, that this wasn't the contracted rate. This wasn't what the provider's health insurance had negotiated with the lab company to do these particular tests. And so they were able to get this number down from $1,800 into around the $300 and change range. Mm-hmm. But then what's really awesome is the employee ended up paying zero out of pocket for these labs. Where's the applause? Yeah! So the bottom line is that the employer is happy because the employee is happy because they paid nothing for these labs. Now, let me get to my point here about this. Anytime you have to pay, I'm sure this Purple Card membership costs extra. I mean, I have no idea, but I'm sure it's an add-on service that you have to upgrade to if you have this particular benefits broker for your business. So now you're an employer and you want to keep your employees happy by having them get their labs for free. So you're having to pay a fourth party mm-hmm. to help keep tabs on the third party payer that you're contracted with because you can't trust them to keep it straight with the second party, the healthcare provider who's overbilling massively for these labs. Yep. Do you see the problem there, Tom?
Yeah, and why do they always pick colors? Purple Card, Blue Cross. It's the fascination with colors. Maybe it's a marketing.
Well, they got to stay away from numbers. They got to stay away from those 5- and 6-digit numbers involved with this.
And I find it funny. Nobody ever asks why it's not done right in the first place. My dad used to say, if you can't do it right in the first place, don't do it at all.
Yeah. Yeah.
How the
Yeah.
hell did you end up with $1,800 in lab charges in the beginning?
I, I,
What if you didn't have the purple card?
I couldn't
Right?
tell you. I mean, I could not tell you. And I find it amazing. I find it amazing that these health benefits brokers have positioned themselves as the saviors, the would-be
Yes.
rescuers, the team that you call when there are issues with your health insurance. When it's so simple, folks. If you just get away from having health insurance pay for most of this stuff, go self-insured. Get a
Right.
really high deductible plan. And Tom, you tell us about that. Give us some options here for this would-be employer. Because let me tell you, let me finish the story. Having that employee get those labs for free does what? We just mentioned it. What will that do to the rates and the premium again next year for that employer?
Let's see. It goes down. No, I'm sorry. Up. Yeah.
Goes up.
There we go again. Yes.
Great.
Yes.
So
Right.
if you were going to come in and compete for this employer's business next year, and I would love for you to, tell us what you would discuss with this employer about how they've screwed up, how they don't need the purple card or whatever it is, and how you can help them better.
Well, you need transparency first and foremost, and the only way to get that is to self-insure in some capacity. And every employer is deathly afraid. Excuse me. Every HR person mainly.
Oh, yeah,
Then
right.
you have your CFO, who is deathly afraid of that phrase, self-insurance. And self-insurance is on a continuum. There's totally self-insured, which are the Walmarts, the General Motors, the Fords of the world. There's no insurance, and you just pay for administrative services. On a small employer, you can be self-insured by sending your employee across the street to an urgent care center to get stitches and a paper cut. Congratulations, you just self-insured a work comp claim. So in that continuum, there are several options to where you can pay for things directly on a transparent basis. Heck, even within your Blue Cross or your United or Cigna plan, without having to go through what you just described of the third-party payer screwing up something or some sort of administrative clerk at a lab miscoding a lab draw or something. But if you're going to be self-insured, the mistake that most people make is they just go self-insured. They go from a fully funded plan and just based on the numbers in a spreadsheet, oh, well, the total cost of self-insurance is less, therefore self-insuring is the option. No. Self-insurance is a tactic. It's not a strategy. If you're going to be self-insured, you have to have the mechanisms in place on the front end to make sure that $1,800 lab bill doesn't occur in the first place.
So it never comes across your desk in the first place. So instead of Monday morning quarterbacking this and putting out fires all over the place with the help of the purple card or your broker, instead your broker says, "Hey, look, we're gonna get some of this pricing up front. We're gonna be transparent."
Correct.
Yeah, that makes
Correct.
sense.
Hey,
that makes sense.
when you need a lab, maybe you have a direct primary care physician. Consult with your direct primary care physician, or if you need a lab, call somebody who's going to find the best cash price service for you in your area based on where you want to go. And you certainly don't mandate anything, but you say, Mr. Employee, ABC Lab here can do this particular lab draw for an all-in price of $25, or this lab BCD lab draw service can do it for $50. One's closer to you by 3 miles. One's a little bit further drive. Where would you want to go?
Yeah, exactly.
You can't be self-insured without that. And then, people always complain, well, we're too unhealthy and we're nervous about the high cost claim. Well, if you manage it appropriately, bring in customer service, right? Then a lot of these things could be handled a lot more efficiently with a lot less stress. Because I'm sure even though that was paid 100% in the end, that didn't happen overnight. That was probably a month and a half of hand-wringing and consternation between the employer, the employee, and frankly, the people from the purple card who actually went in and resolved the issue. There's a time value to the stress that went into that.
Absolutely.
At the front end, it'd have been alleviated totally.
Absolutely. Yeah, the purple card. I was just floored when I read this. I was like, okay, so you have to, just the layers and layers and layers. And none of this has to do with health care. None of it, folks. None of this has to do with the fact that you're going to get some health care from your doctor or your provider, whoever. This is all just added on complexity and layers. And to me, The idea should be to minimize that, to minimize the junk, get all these layers out of there that don't need to be there. And I think next time we're going to talk about this self-insured stuff and some options that employers face with legislation that President Trump concerning association health plans. Next episode, we'll talk about that in detail and try and get some skinny on that for folks. But what I wanted to say in wrapping up this show, this episode, is that it's not about just the amount you're charged. So you're charged $1,800 for some labs, but I just put up a tweet about how a lady went to an emergency room here in Dallas. This was years ago, and it was on the news, so they flashed her bill across the screen. She was charged $580 for the air that she breathed to be pumped through a nebulizer machine. Now, these nebulizer machines cost around $30. Okay? Yep. They cost around $30 for to have this machine. She didn't even get to take this thing home with her. They charged her insurance, or they charged her $580 to blow air through this machine. It's an oversized fish tank pump, basically.
Yeah.
And they gave her a breathing treatment, lasted about 10 minutes, charged her $580. So these charges, again, it's not the cost, it's the charges. But it's also what they charge you for. If you go into a restaurant, you're going to get charged for a glass of tea. They're going to charge you for the iced tea. They're going to charge you for the glass. They're going to charge you for the ice cubes. They're going to charge you for pouring the tea in there. Nobody would pay that. Nobody would go to that restaurant again. Yet this is how healthcare works. It's sort of like one of my patients is a gardener, and he was telling me the other day that, it would be like me charging a height adjustment fee on your shrubs or on your trees. And, and we added in modifiers. We're like, okay, so if you have a 6-foot tall shrub and you want it brought down to 4 foot, if he's got to get on a ladder, he charges you a little extra modifier there for that. No, I mean, that's not how it works.
Like Josh with thorns. I hate to see you charging roses.
Right, a danger fee.
I got a good one. My days working at the hospital when I used to review what we called single case agreements, we would negotiate them for a non-insured patient. I saw a charge for a $12 mucus collection device. It was a tissue.
I'm going to guess that's got to be a Kleenex, because I can't think of a medical.
Thank you.
I've never seen a plastic. Well, I have seen the suction tubing, but that's for, that's for intubated patients and really sick people. But yeah, a tissue. You're saying a Kleenex was billed at $12.
Yeah. So so segueing to next time, when you're an insured, forget about the ease of it. Just as an ethical, responsible level. To write checks to have that stuff covered is just crazy.
Yeah. Think about what you're trading, employers, for the ease, for the just, I don't have to, I just put it out of my mind. They all take care of it. The insurance takes care of it. Think about what you're trading for that. And I want to say this too, and we'll get into this more next episode for sure. But even if you're self-insured, and I want you to define that concept for me here in a second.
Sure.
But even if you're self-insured, where your company is doing most of the healthcare payments, if you're having that administered through a health insurance company, then correct me if I'm wrong, you still have to do 3 things. You still have to suffer where to go to get your health care through the health insurance company. They get to tell you where to go to get it through their network. You have when you can go to get your health care. They tell you when you can go. They say, okay, we deny that claim or what have you. So they act as a time barrier. But most importantly, if you're using health insurance to buy your health care, you're paying the price that the health insurer negotiates on your behalf.
Correct. There's really no functional difference between being insured through what's called a BUCA carrier, Blue Cross United Cigna, Aetna, or self-insured through a BUCA carrier. Functionally, there's no difference. The only difference is when you go in to get screwed, at least they give you a tub of Vaseline when you walk into the room if you're self-insured.
Now, what would that be called? No, never mind. I'm not going
there. I'm sorry. But hey,
I'm not going there.
Get screwed, at least you're going to know it being self-insured. The panacea is the independent fiduciary third-party administrator administering your claims. So if you're going to adopt and be in this employer-sponsored model, it's management of your expenses like you do anything else in your business, and having an independent fiduciary, not only third-party administrator, but broker, pharmacy benefit manager involved in making sure the plan operates properly.
Yeah, it's like I said in another tweet or something I put on social media recently that these companies that spend all this money to have this health insurance and this purple card benefit and they're paying their broker, they're just bleeding money to all these places. I'll bet you they have somebody on staff to find them the best deal on office supplies, on mucus collection devices that hang out around the office, on Kleenex and things like that, janitorial services. I guarantee you they have somebody who's looking at that, somebody who's absolutely keeping tabs on that, and yet they're entrusting this healthcare stuff to folks who are just
and I've been accused of hating on the employers, or I'm very anti, and that's not the case at all.
No.
I'm actually trying to help these employers from the racket that is the system, right? And if anybody's hating on the employers, it's the current status quo players who are putting the same old stuff that have been overcharging people for decades.
And don't forget, and this is something else we'll talk about next time, we'll talk about the article that just came out.
Yes.
About how these brokers are getting massive kickbacks, not just commission, but kickbacks and gifts in exchange for, what did I talk about? The gold plan, in exchange for selling you the gold plan that you can put hearing aids in everybody with.
Right.
So, Tom, that's it for this week. I appreciate your time again, and thanks for showing up. Everybody, you can find Tom with Benefit Advisors of Charleston, South Carolina. He's available to help you nationwide, though, on much of your employer needs. If you're interested, give him a shout. You'll find all his contact information in the links. And until next time, Tom, I thank you again so much for your time, and everybody, stay healthy. Now you can easily compare health insurance plans and pick the one that makes the most financial sense with the Dr. W's Equation app, available for Android and iPhone. And for more information on how you can save on health insurance and healthcare, check out my books, available now on Amazon, iTunes, and Nook. To help spread this message, please click the like button on this video. You can also subscribe to the Healthcareonomics YouTube channel and visit healthcareonomics.com.